Hi, my name is Nancy Duplo, and I'm one of the occupational therapists at the University of Rochester Medical Center, Wilmot Cancer Institute, that works with individuals with lymphedema. Today we're here to talk about the definition of lymphedema, the three parts of the lymphatic system we're concerned with, healthy habits to assist with risk reduction for lymphedema, 4 components of complete decongestive therapy, and future videos. The first thing we're going to start with is the definition of lymphedema. Lymphedema is defined by the National Lymphedema Network as an abnormal collection of lymph fluid just below the skin. This fluid is intended to be in your body and to circulate through your body several times during the day. However, at times, due to surgery, radiation, chemotherapy, or other issues, there may become a blockage which prevents this circulation. If we look at our poster of the lymphatic system, we can see that there are 3 parts that we need to concern ourselves with. The first is the lymph nodes. The lymph nodes act as a vacuum for the system to help pull the fluid, in the case of the head and neck, down towards the venous arch of the heart, or in the case of the rest of the body, up towards this. They also help with the production and stimulation of T cells and B cells. The second part that we want to talk about is the lymphatic vessels. These vessels are small vessels scattered throughout your body that are typically very close to the skin. The vessels are incredibly small, usually the size of a human hand. The third part that we're concerned about is the lymphatic fluid. The lymphatic fluid is composed of water, protein, which is different than the type you would eat, bacteria, white blood cells, and some other things. This fluid helps to stimulate your immune system and to prevent infection. When considering the lymphatic system, we want to make sure that we participate in healthy habits that help us to reduce our risk of lymphedema. So you may get a paper like this from the National Lymphedema Network. It's been modified to reflect our views here at Wilmot. The first piece of information is leading a healthy lifestyle. This means maintaining a good weight that you and your doctor have decided upon, and completing exercise. Exercise isn't always activities at the level of a marathon or lifting 50 pounds. Exercise may be walking around the house an extra time during the day, or completing your exercises from speech-language pathology to help with the movement of fluid in your throat and in your neck. The second healthy habit is skincare. Skincare is important because we don't want our skin getting dry and pushing on those small lymphatic vessels. This means that you need to lotion daily with a dye-free, scent-free lotion such as Eucerin, Aquaphor, Cetaphil, or even Dermasil from the dollar store is excellent. If you have leftover Radioplex, that would be fine to use as well. If you notice any nicks, cuts, or scratches on your head and your neck, this is something you would want to keep an eye on and address as you and your doctor have decided. The next portion is medical checkups. If you feel that you're developing lymphedema and are noticing increased swelling in your head and neck, or in your face, or your ears feel full, please contact your oncology team and let them know so that they can discuss with you an appropriate treatment plan. The fourth part is infection education. So if you notice that your skin is dry, maybe there's a cut that is becoming infected, you would want to take care of it sooner rather than later. And you also want to avoid behaviors that can encourage the risk of infection. So if you're not sure if your razor should be used or not when shaving, this would be a time to get a new one. We also want you to prevent injury or trauma to this area. Any type of constriction should be avoided, as well as extreme temperatures. This means avoiding hot tubs, saunas, and whirlpools for greater than 10 to 15 minutes until you determine how your body reacts. The next thing to discuss today is treatment of lymphedema, which involves complete decongestive therapy. This typically involves 4 things. The first is skincare, which is essentially what we discussed in Healthy Habits, where you would put lotion on your skin, make sure that your skin stays well. Exercise, as previously discussed. Compression, which may or may not be used during your treatment plan. and manual lymph drainage. Manual lymph drainage and how to complete will be discussed in future videos in terms of how to complete on your own or with another individual. Should you have any questions about the information presented today, please contact your occupational therapist at the number provided or through a MyChart message, or you may call the Rehab Access Center at 341-9200 and they will get us a message. Thank you very much for viewing the presentation.